Let's take a look at this case of an ankle twisting injury. What we're seeing on these axial representative slices, proton density through the level of the talus, we can appreciate the marker that's been placed in the area of interest, which is anterior to this structure here, which is going from the tip of the fibula to the lateral aspect of the talus. And that is your anterior talofibular ligament, comprised of two bundles. This is the more superior bundle. This is the more inferior bundle. And we can see the sprain. The sprain is denoted by the thickening, the interstitial edema, and the slight laxity. What we're looking at is the superior bundle. So we know that the ATFL has actually two bundles, a superior bundle and an inferior bundle that actually joins forces with the calcaneofibular ligament through arcuate fibers. This is the most commonly torn ankle ligament. Acutely, we'll be looking for that discontinuous, wavy, lax ligament with surrounding edema. And then chronically, we'll be looking for that irregular, thick or thin or detached ligament. Associations with pathologies of the ATFL include sinus tarsi syndrome, anterolateral impingement syndrome when it becomes hypertrophy with synovitis, even associated, as many things are, with peroneus brevis split tears or talar dome osteochondral fractures. And here's an example of an ATFL sprain.
Fantastic. So this is a great case of a 42-year-old female who comes in post-ankle sprain. This has happened 1 month ago. So just looking at the axial images on this fluid-sensitive sequence and sagittal images, we can get the sense of the degree of effusion and going in to evaluate the ligaments now. So while we start up high up along the syndesmosis, we begin to see that the layers of the anterior-inferior syndesmosis actually have some type of edema between them, but they're still intact and I can still see them in this way, and I can see the lowermost fibers. Moving past that region, now we get to the region of the anterior talofibular ligament, and notice I have an irregular ligament, the fibular attachment also slightly more frayed, and when we look at this under also T1, we can see the sort of irregular changes along the bone, the early pull along the bone, the stress-related change. So just bring it back up to our axial images. We can see that I would call this a sprain/partial tear because it has laxity to it. That's the rest of the ATFL. And then we can look at those fibers of the PTFL we see, and the calcaneofibular ligament here. Part of it is here. There's periligament edema, and there's sprain and irregularity as it attaches to the inner aspect of the distal fibula. And we can also appreciate, seen on the coronal imaging, we can see the region of the ATFL and the sprain that's occurring more on the fibular side and the actual edema at the lower tip. We can also see the calcaneofibular ligament seen deep to the peroneal tendons as this band here, the structure that's actually attaching from this region. We can see that sprain and periligament edema in this thickened ligament.